name is Ashley Toski, and welcome to the Mendocino County COVID-19 update today. As normal, we are joined by our Mendocino County Health Officer, Dr. Andy Coren, who will give an update on the COVID-19 status of our county. We will then hear from Mendocino County CEO Carmel Angelo, followed by Deputy CEO Darcy Antle. After that, we will be happy to take a few questions from the media. Unfortunately, due to scheduling, we have to limit these questions to 2 questions from each media outlet in order to preserve the schedules of our staff. If time allows, we will also be happy to take questions from our public. So if you are a member of the public and you have a question, please leave your question in a comment on this video below. Some of our speakers may be invited to talk during Dr. Coren's update, so listen out for that. Now, beginning with the health update, Dr. Coren, you have our attention.
Hello, everyone. Hola. In the United States today, the coronavirus cases number 26,522,026. This is actually as of the 3rd, not today. The deaths are over 450 million. It's now 450,797,000. That is in 1 year more than the American lives lost in all of World War II. California cases are up to 3,368,281. And the deaths at this point are 42,484. That was 500 in a day. Here in Mendocino County, we also have a very high numbers, though they're coming down since the holidays. As of the 5th, our average daily new cases are 21. It ranges between 20 and 25, bounces around in the last week or so because we are a small county, so small numbers make a big difference. The test positivity rate is 7.29%, which is up higher than we'd like it to be. And it's because we do not have as much testing going on in our community as we had before. We're down to a half or less than we had in early December and end of November. And I want to encourage people to get tested, even if you're vaccinated. That positivity rate really helps to determine if the pandemic is worsening. And it also helps us to get down to lower tiers on the governor's tier schedule. Total cases here have been 3,487, and of that, 1,774 or 51% have been in the Latino community. Currently in isolation, there are 208 people, and in quarantine, 271. The deaths now in our community, unfortunately, have gone up to 39. You'll notice that has been an increase since we last talked. And the reason for that is because when there's a surge in cases, following that, there's a surge in hospital and ICU admissions, and then the surge in deaths takes its toll. Of those deaths, 13 were from the Hispanic community. In the hospital at this time, we have 5 in the med-surg, and there are 2 in the intensive care unit. One of the people we have in the hospital is from out of county, and 2 of the Mendocino County residents that we have are hospitalized out of county. So altogether, we have 11 in the hospital from our county at this time. Becky, who's the director of our Department Operations Center, I think is going to tell us about any outbreaks that we have currently. Becky, can you chime in?
She may be having some technical difficulties, Dr. Coren, so I will check on that. But if we can move on to the next point and we'll circle back around.
That's good. So just to remind people, we are currently in the purple tier, which is most activities are outdoor, including bars and breweries, which are closed to the outside. Restaurants are outside only. Gyms outside only. Places of worship, wineries, and personal care are outside only. Retail capacity is to be kept down to 25%. And the schools, if they're open, if they did open in red while we were briefly in the red tier in November, can stay open. The K through 6 schools are staying open, and there are a few other small schools that are sending in their safety plans, and others of the later grades are sending in safety plans, so they're prepared to open when we get into the red tier, which is when our case rate will be down to less than 7 cases per day. I see Becky is on. Are you able to pick up on the outbreaks currently in our county?
Good afternoon, Dr. Coren. Thank you. Yes, I am. As to the outbreaks, we have 3 outbreaks that we're currently responding to, and one is the continued outbreak at the jail that we continue to work very closely with the Sheriff's Department on in that effort. They have certainly been working to ensure that they have people into isolation and quarantine quickly and timely. They currently have 3 individuals that they are working with there that are positive. All of their staff have been released from isolation, and we continue to see them do testing twice a week of all inmates and staff, and are continuing that effort as well. So really working to mitigate this spread. One of the second outbreaks that we have is in Round Valley. It has been an ongoing effort in partnership with members in Round Valley to be able to mitigate that as well. We have testing that we are doing there, outbreak testing this weekend for that event, and we'll be continuing to monitor. It is several factors for that outbreak. One being some individuals that have been sharing multiple housing opportunities, and another is an event that a memorial event where there was singing, and individuals did diligent efforts to space out, keeping 6 feet, not recognizing that for singing they really need to be further apart, and so there's been additional spread, and also that you know, for these events we really discourage that singing and those efforts. And then the final outbreak that we have been responding to involves multiple restaurants in the Fort Bragg area. And again, we are doing testing there on Sunday from 9 to noon in response. The restaurants, while not, some of them do not have 3 individuals within their own restaurant, but there is a consortia or a group of people that work between these multiple restaurants and have been positive for that within the event, and resulting in continued need to list all 7 restaurants as part of this spread. We continue to work with those individuals and are working to ensure that they are aware of the safety practices, and that's part of why we want to ensure also that our communities are getting tested and accessing the outbreak testing that we have ongoing.
Thank you, Becky. So I'll move on and talk about the vaccines. In California, the total administered is 3,649,440. And in Mendocino County, as of January 29th, we had administered 7,532 first doses through public health. Adventist Health had also administered 3,631, which gives us 11,163 individuals with their first dose. Now, there are over 700, and probably by now closer to 1,000, who've gotten their second dose. But if we just look at the number of people who've had a vaccination, and we divide that by the number of people who are over 16 years old and therefore eligible for either of the 2 vaccines that we have now, then we get to a number of 15.8% of eligible people have been vaccinated at least once. This doesn't include those who are vaccinated by the pharmacy, the national pharmacy contract that goes into the nursing homes and long-term care facilities. It has been very difficult to extract those numbers. The vaccine supply is still a major challenge. Ordering and accounting for the vaccines is very complex, and it's changing. We have used old-fashioned spreadsheets and vaccinate Mendo, the wait list that was created by 2 of our supervisors, and are now using Schedule Genius. The state has changed its platforms several times. They've gone, some of you may recognize COVID Ready, CalVax. New platforms include PrepMod and MyVax. Next week, Mendocino has been chosen as one of the rural counties to pilot test MyTurn. This is a new state site that would help streamline this process by people signing up, and the site would check your eligibility and then find a vaccine site when your eligibility comes up, notify you, and help set up the appointment and begin the reporting. We're continuing to do some old-fashioned methods because as we've seen, some of these new platforms don't work the way they're built initially. And so we're going slowly with our IT team and expect, though, much better functionality both in the county and statewide. So because we have done so well as a county, the state has allocated more to us. And that was seen back in middle of January when the governor wanted to show that we could distribute 1 million vaccines in the next 10 days. And we took 2,400 extra doses at the end of that week. And we were actually able to distribute all of them in a few days. And we have just gotten assured, and we'll get in the second dose vaccines for all those people who were vaccinated that week. That took a little bit of struggle with the state, but we made it. We have partnered with 3 hospitals, 6 clinic partners, and the city of Ukiah to get through this pandemic. Several of the clinics have applied and are awaiting direct shipment of vaccines. The county developed a safe model for mass vaccine events, and each of the clinics are doing their own events. Also, all of us started slowly to assure that it was a safe process, and we have scaled up now to 200 to 300 at each event and several times per week, with plans to do more as the supply is adequate. So as I said, we've vaccinated up to 15.8% of our county population that are eligible for those vaccines. And we have also vaccinated about 70% of the school staff because opening schools is such a priority. It is now in view. We have estimated that with our current vaccination capacity, we could, if we had the supply, deliver between 7,500 and 10,000 shots per week, which would equate to 2 doses to all of Mendocino in 6 months. Yet based on current availability, it'll probably take till the end of May to finish just those over 75 years old. So bear with us. And we will work with adjusting our tiers as it becomes possible to vaccinate more of our community. At this point, we've been getting the vaccines out to people who want it within 1 week and waiting no more. Oh, second here. So where are we now? Keep in mind that the state may be changing some of their requirements. There's a lot of changes at the state level. The tiers currently being vaccinated include those who missed or declined their first offer from phase 1A, tiers 1, 2, and 3. And we have now moved on to phase 1B, tier 1, which is anyone over 75 years old, education and childcare workers, and agriculture and food sales, prep, and service workers, which include many of the people in our Hispanic community. The county vaccines have already reached, as I said, 11,163 individuals. Adding others in the 65 to 75-year-old group would be another 12,830 people. And so we're looking at how can we open up those additional tiers while we're still in such short supply. And I've been having some conversations with the clinics who in some communities are actually running out of willing 75-year-olds, but they're not ready to get down to 65 without other criteria because of the supply. So we're thinking about opening stepwise and including people with disability, but that work is to come. We're depending on our partners to help get out these vaccines to the community. And as I've said before, we want to make sure that those people who might have difficulty going to a vaccine clinic, in particular the elderly people in our community, 75 and above, will be going to hospitals and clinic events because it's much more conducive to give the vaccines to them there. Whereas clinics that have mass vaccine events in the county, mass vaccine events, will be focusing on people who are at risk due to their employment. For example, teachers at mass vaccine events, agricultural workers. And for those who do not have a medical provider who's vaccinating, Dr. Theron Chan, who's a deputy health officer, is working with private medical providers to arrange that their patients get vaccinated among the clinics that do have the vaccines. I'm going to move on to the next section, which is just to let people know that we really understand that this is a very changing environment. The promised vaccines from the national level have not come out as quickly as the state would have liked it, and the state is having some difficulties with their distribution and their accounting, and they've made a number of changes which we all, of course, have to get in line with. But we have also made some changes over the last few weeks. We are now publishing on our websites the numbers of vaccines that we receive and use, and another to show when our clinics are scheduled in the county and with our 6 partners, and to begin to schedule appointments. We are also reaching out to the public in many new ways. We're going to continue with the KZYX presentations and add a Spanish radio program in KZYX as well. We've been putting our COVID information page, including the vaccines in Spanish, and distributing press releases as needed. And we've, of course, increased our call center staff to handle the hundreds and thousands of people who are calling for information. In summary, there has been a holiday surge. There has been winding down from that, and the vaccines are here. We're allowing more schools to open as the case rate has decreased under 25 per day. We aim for 7 per day or less in order to open more of the schools. The higher grades will be able to open at that time, but we still have a long way to go for that. We in Mendocino are getting the vaccines out safely and as quickly as possible, but we must not get overconfident. We are a long way from being stable and safe. People also have heard about this new threat that's come with mutations in the virus. And as you may have heard, there are 2 that have been identified in the world that increase transmission. 1 may increase severity. 2 new ones have been found in California, but it's too early for us to know the characteristics of those viruses. California is one of the largest genome testing area programs in the country, if not in the world. There's 1 other that may be resistant to the vaccine from South Africa. This could cause a springtime surge and another shutdown. So I don't want people to get overconfident. The less cases we have, if we keep it under control, the less mutations are possible. So stay vigilant. Keep testing. Very, very important for us to track and mitigate outbreaks. Even after getting vaccinated, keep testing. The vaccination will not affect the validity of the tests. Mask up. Keep your social distancing. Avoid gatherings, even on Super Bowl weekend. Try and avoid those parties. Increase indoor ventilation and wash or sanitize often. Do we have CEO Angelo on the line?
Yeah, we do not at this point. We did plan to have CEO Carmel Angelo and Deputy CEO Darcy Antle join us to give an update, but they are currently on a phone call with Senator Mike McGuire. So I do not believe they'll be able to join us. If they do, I will announce it and we'll have them give an update. But thank you for your update, Dr. Coren. Right now, we will move on to questions from our media partners. The first on my list is Danila Sands. I do not see her on the Zoom meeting currently, so I will move on to Susan Wolbarst. Susan, whenever you're ready.
Thank you. In terms of this outbreak in Fort Bragg, I was a little unclear with what Becky was explaining. Is it being spread by people who work at several restaurants? Is that the idea?
Yeah.
Sorry, go ahead, Dr. Coren.
Okay, so when we found out about it was a little bit late, but testing in the area showed several people had it, and they also worked in various restaurants. So within some of the restaurants, a number of people got it, and we believe that that's person-to-person transmission within the workplace. We don't yet have any evidence that people in the community caught it from their contact with the restaurants, because their contact would be pickup and not eating inside the restaurant. So the likelihood to get it from passing off the food packages is fairly small.
Okay. So mainly staffers.
Yes, we're doing the testing to be absolutely sure, but it is mostly staff who test it among themselves, like in any other workplace.
Okay, great. And in terms of the jail outbreak, with the 3 current people testing positive, you also had 1 person die last weekend who apparently picked up COVID in the jail. It didn't say that explicitly, but that's the gist of what I got. Do you have a current total number for people involved in that outbreak? The last I heard was over 90.
The cumulative total, I believe, is over 90. At this point, there's only 3 that are testing positive. And remember, the jail is a very high-risk congregate situation, and people are always coming into the jail. So as much as we try and separate new inmates from other inmates and anyone who may have come in contact, it's a very difficult environment to ensure that. So we've gotten down to 1 inmate that was positive, and we were on our 2nd round of testing. We thought we were all of them were negative, and then 1 other sprung up, and then we got another 2. So it's a smoldering outbreak that's going on. As far as the person who passed away, I don't want to get into details because of privacy issues, but there were other diagnoses that were involved that made him very debilitated, though I don't think we should underestimate the fact that COVID was very much involved.
And as to those totals, we've had 17 employees and 128 inmates.
Thank you, Susan. Next up, we are going to head over to Tanya Horlick from KMUD. Tanya, whenever you're ready.
Thank you. Can you hear me?
Yes.
Yeah.
Awesome. How many people are now waiting for a COVID-19 vaccine in Mendocino County, and which tiers will be allotted vaccine next?
A good question. So first of all, you have to separate out those people who are not eligible to the current vaccines because they're less than 16 years old. So just on the basis of the emergency use authorization, it would come to in the range of 70,000 who are eligible. There are many people who are hesitant to get their vaccines But if we take the 70,000 that could be eligible and we subtract that 11,000, and it's probably a larger number now, that would come to about 58,000 that probably are waiting for their vaccines. We're going to march through the tiers and the ages group in a systematic way, because we have already experienced when people flood the lines and we just don't have the vaccines. And we want to make sure that those people who are higher at risk of getting severely ill are getting their vaccines first.
Understood, and thank you. Have people who were given the Moderna vaccine exhibited different symptoms from those who took the Pfizer vaccine?
I don't think we've seen different symptoms at this point. They're very similar to what they had been billed at as when they got their emergency use authorization. There's a little bit higher frequency, still very small, of anaphylaxis in those people who got Pfizer, but we're looking at national statistics. We would not have any meaningful statistical analysis within Mendocino County among those people. And we've had very few cases of anaphylaxis here. And one of the reasons we started our vaccine clinics so slowly and small was to be sure that we were covered for that possibility. And outside of every vaccine event, we have emergency service workers who can deal with anaphylaxis if we need to.
Thank you, Tanya. Next up, we will go over to Kate Maxwell. Kate, whenever you're ready.
Hi, thanks, Ashley. So I first wanted to follow up to get a little bit more information about the Fort Bragg outbreak. I was hoping you mentioned that the county had come to this outbreak a little bit late and that testing would be happening this Sunday. And so just trying to get a handle on the time frame and the scope of the outbreak, I was wondering if you could, give us just an overview of when those cases, when the last cases were found. I know some restaurants have closed for some amount of time now and reopened. And so just if you could walk us through that timeline with how many cases, and then explain to people, will the test still work if people were exposed a while ago? Is this Sunday going to be adequate to kind of track the scope of that outbreak?
So let me start with some of the facts, and then I'll have Dr. Coren add to that as far as the testing and those pieces. So it has been over the last 2 weeks that we have been tracking and identifying. Keep in mind that as COVID spreads, it takes time to transfer from one person to another and for them to develop those symptoms. In total, we have 15 employees between the 7 restaurants that have been identified that work at, some of them work at multiple restaurants. And so working through those pieces has certainly been part of this challenge in identifying these outbreaks. We continue to offer the testing. We do have our outbreak event is scheduled for this Sunday from 9 to noon in Fort Bragg. It is a first come, first serve. And we want to encourage people to get tested because this virus, as it spreads, certainly, as we have shared, can take 3 to 4 days, even as much as 10 days to develop, and further, for people to develop those symptoms. So even after our outbreak testing event, we encourage people to continue to use testing opportunities as screening as we continue to move through any of our events that we've had for outbreaks. Responding and getting control of those, testing is a key piece of that, and getting those results quickly to place people in isolation and quarantine as needed. And so that's really why we want to encourage this testing. And I know, as it does say, that we came to it late because it's 2 weeks to identify, but part of that, as I've said, is that time frame between spread of one individual to another. And because this overlaps so many different places of business, to be able to identify that within this group of individuals has been somewhat of a challenge in identifying those outbreaks.
Let me just add to that. Let's not forget that in order to identify something as an outbreak, we need to have 3 individuals in one place of work. And so it took a while for those 3 individuals in our contact investigation tracing to figure out that there was an outbreak. And even then, in terms of calling it an outbreak of 7 businesses, it's a little bit of a liberalization of the term outbreak, but we feel that it's worthwhile to follow all these cases as an outbreak. The other thing is that one of the individuals who was a key index case was very concerned about giving information and talking to our contact investigator. And so it took several calls. I actually got on the phone myself and was able to convince that person that this was not going to be an issue where documentation or risk of license was at risk, and that we really wanted to do the contact investigation and tracing, not only to figure out how extensive this was, but also to protect others down the line and to give social services type of assistance to people who may need to be isolated outside of their own home, and for food, and we have other services for people we identify who have COVID. So the concern about, and this is true of a number of people, it's sometimes difficult to gain the trust of people who do have the infection, and so that sets us back. And all those factors added together to make this delayed, and I agree, it is delayed. Does the testing still make sense? Yes, because contacts can still spread it to other people, and they will be cases. And with our testing, we can uncover them and hopefully contain this so it doesn't lead to other outbreaks. Does that make sense?
Yes, thanks for clarifying those things. I think that's helpful to understand the situation of what's going on there and what people should do now. So my other question is, hoping to get some more information about the current plan regarding vaccine distribution and providing that information to the public. So I know, I think you all county officials and the hospitals have all done a really good job at explaining how difficult this has been to predict on a federal and a state level. And clearly the state tiers and the state guidelines have been shifting over time. But I know the county established a vaccine ethics committee in part to address concerns about equitable distribution locally. And I'm looking at the county dashboard with that you mentioned earlier with the vaccine distribution right now. But so I was wondering if you could speak to, for each new dose or each new batch that the county specifically receives. I know that the county may not have control regarding the hospitals and the clinics and people getting their own batches, but is there a clear plan for each incoming dose of vaccines and that is currently in place, so that when the county does find out that there will be more vaccines coming, is there a clear plan of where those will go or how they will be distributed? And would the county be able to provide comparable information about that vaccine distribution akin to the COVID cases? So could we get a sense of how many in each zip code? Are they men or women? Are any additional details, are they going to the Fort Bragg Fire Department or this school district? Can we get any additional information about where those are going or how the county is planning to do this going forward?
Well, when we get notified of how many vaccines are coming in, we are hoping that we have an accurate idea of when the clinics are planning their events, and we try and first look at that. But there are also other considerations. including how many vaccines have already gone to those communities. And some of them now are reporting that they can use a little bit less and some a little bit more. And the clinics are talking amongst themselves to help distribute it. We're trying to get more systematized on how we learn from the clinics what their needs are. We want to make sure that people who've had a vaccine either 3 or 4 weeks before are going to get their second vaccines. But we're trying to get as many vaccines as we possibly can and distribute them as fairly as we can throughout the county. At this point, I don't think we have a zip code map of where these vaccines have gone. And we are pretty much all inviting people in on the basis of lists. And that's one of the reasons why we're looking forward to this new platform, My Turn, to help sort this out. Would give us a way also to be recording it. I hope that answers your question. You raised some good questions, but I don't have all the answers to them.
Thank you so much, Kate. Next, we will go to Sarah Reif. Sarah, whenever you're ready.
Hi, can you hear me?
Yes.
Okay, thanks. So I am looking at the third report from the Promotores de Salud, and that's the organization that the county contracted with to do outreach to the Spanish-speaking community. And it says that access to vaccines and translated vaccine information remains an obstacle. And that vaccine eligibility language for workers needs to be modified from pay stub to employer ID, pay stub, or a letter from employer to accommodate those who are eligible but working in the cash economy. For example, caregivers and food and ag workers who might not have all the paperwork that they need to be here legally. And I'm wondering if there is some effort to make sure that people who are eligible, who are doing the work and they're in the tiers, but just don't have all their paperwork together, can get their vaccines.
That's a good question. Yes. So we've had this discussion actually in the ethics committee that you mentioned. And we do understand that some people do work in a completely cash economy. We do need to have 2 methods to identify people. And so that's been required, but people can use any other form, any secondary form of identification. It does not have to be a United States or California ID. We've accepted Mexican passports and other kinds of methods to identify themselves. We would like to have, if they're coming in because of their employment status, at least a note from their employer that says that they work for them in such and such a way, so that we can follow the distribution in an equitable and a fair way. We recognize this is a problem with undocumented workers, and we're trying to work around that and be as liberal as we possibly can. But there is also a fairness issue, and we have to identify that people are who they say they are, and that they qualify. Finally, we are working on, through the Spanish language radio that will be starting next week, and through the production of this event in Spanish, as well as our literature we put in Spanish. It is something that is developing. I would not say that it's perfect. It is, the disparities are there from decades and decades of unfairness, and we're trying to get around that.
I'd like to follow up on another issue that came before the ethics committee, and that was that I believe the committee decided that it would be all right to vaccinate inmates in the jails before their tier came up at the state level. And I'm wondering if there's an update on efforts to vaccinate the inmates at the jail.
Yes, Sarah, that has not been discussed in the ethics committee.
I thought it had been.
No, the staff that are associated with law enforcement, the sheriff's department, and the courts, people who are directly exposed, have been moved up in their tier and have been vaccinated.
Okay, I was unclear. I thought that it was inmates, not just staff. Thank you.
Thank you, Sarah. Next up, we're going to go over to Jacqueline Orozco. Jackie, you have our attention.
Hi, thank you, Ashley. My first question is, Dr. Coren, why do you think the communities of color are being left behind?
Jackie, it broke up a little. Can you repeat it again?
Hello, Jackie.
Okay,
Hi, Jackie. I'm sorry. I think we are having some technical difficulties on your end. Can you hear me? Okay, Jackie is our last media partner who's going to ask questions. So maybe we'll circle back to her. Let's quickly go over to CEO Carmel Angelo for her update. She just joined us from an important
oh,
call.
yes. Can you hear me?
Oh, yes, we can hear you, Jackie. Hi. Go ahead with your question.
Hello?
Yes. Hello? Can you hear me, Jackie? I'm sorry, Jackie. We can't hear you.
Can you hear me now?
Yes, we can. Can you hear us? Okay, I'm sorry. We'll have to circle back to you, Jackie. Just raise your hand on Zoom when you have your technical difficulties all figured out, and we'll circle back to you. Sorry about that. Moving on, we will hand the mic over to CEO Carmel Angelo for her update.
Well, thank you, Ashley, and hello, everyone. I haven't been on Media Day with Dr. Coren in quite some time. I will fill the air until we could get Ms. Orozco back with us. You know, there's questions always about what we're doing and how we're doing it. And, you know, it's a huge task that the state is taking on as far as trying to distribute all the vaccine that we need. And one thing we do know, and I was on 2 state calls today, and it's only 2:45, and I'm sure there'll be another one before the end of my day. But the state is working long and hard to try and get the vaccine to the counties. So much so that with this new effort, the Biden-Newsom effort, with the federal government moving in with these mass vaccination clinics that will be run by federal staff, and the feds will be bringing in additional vaccine. Our understanding from the state is that they will not take vaccine from the counties or the clinics or the multi-county entities that already have the vaccine. This will be additional vaccine coming into the state. And we know right now that there will be 2 locations. Both will be urban areas, one in the Bay Area and one in Southern California. And the hope is to outreach to those people that are underserved, that don't have health insurance, that don't have health care at all, and that need vaccinated. So it really is a great effort. As an advocate for rural counties, I can say that myself and my colleagues have been working to get some assurance from the state that as we move toward this new model, along with the centralized online appointments for vaccines, and along with this third-party administrator that the state is planning on implementing this month, that rural counties don't get left behind. And we continue to fight to assure that rural counties get the same and more vaccine as we go forward. This will be something that we all need to watch, because it will be every day is a new day with this. So I don't know if Ms. Orozco is back with us, Ashley. I don't want to take any of her time. Do you want to just check and see if she's with us before I go on?
Sure. Jackie, can you hear us?
Yes, now I can hear you. Can you hear me?
Yes, we can. Feel free to ask your questions.
Okay. All right. Okay. ¿Por qué piensa que, Dr. Coren, gracias, por qué piensa que las comunidades de color están siendo un poco relegadas con la vacuna del COVID-19? Why do you think communities of colors are being left behind in the rollout of the COVID vaccine?
Thank you, Jackie. So I think some of the answers are the traditional answers. Language is a huge barrier. And so that's one of the reasons the county is trying to reach out to the Latin community with both our literature and now through the media. We'll be on a radio station starting Monday on a regular basis. So language is one big problem. Another problem is that, as you know, people of color are our essential workers and oftentimes cannot get off of work to get either tested or vaccinated. And they are much more suffering from the disease because of their close contact, both transporting back and forth to work, their conditions at work, and also because of the lower incomes, forcing them into multi-family and multi-generational housing situations. So I think there are disparities within our economy that are going to be very hard to overcome. And that's one of the roles that I see as the county playing in terms of distributing these vaccines. The framework that was developed is attempting to address some of that while prioritizing age, also prioritizing people who are exposed because of their work. And the people who are exposed because of their work oftentimes leaves out the essential workers, which in California they've tried to put in there so that you could say, well, hospital workers or healthcare workers are the doctors and nurses. We also want to recognize that maintenance and food service workers and some of the lesser paid workers are more represented or have more Hispanic and people of color in them. And so in our efforts to use the tiered system, we're trying to focus on people of color as well. Another thing is that the United States does not have the best history of being trustworthy. And so there are a number of groups, Black people in particular, are afraid because of experiences like the Tuskegee experiment. And Hispanics are likewise afraid because of the treatment that they've gotten from our federal government. And for sure, Native Americans have had a horrible time at the hands of our government. And so there's suspicion about taking vaccines. And one of the things that we have to get over is that we really need to approach it from the point of view of teaching people where we're coming from, education, but also there's going to be some time in developing that trust that this is an important thing that we're making available and it is safe. And those are the things I can think of as a reason why they are being left behind, and we're trying to catch them up because they're certainly, if you look at our statistics, much more vulnerable to what we've all suffered with this COVID pandemic.
Thank you, Dr. Coren. My next question is, mucha gente no están teniendo la misma oportunidad para hacer sus citas para ya sea una vacuna o porque no hay accesibilidad a un número de teléfono para llamar, o a lo mejor no están familiarizados con en hacer una cita en el internet para una prueba de COVID-19. Many people are not getting the same opportunity to schedule an appointment because there is not a phone number to call for those that don't know how to do it or are not familiar with online scheduling for COVID testing.
That's true. And one of the reasons why we are working with members of the community, of the Hispanic community, is to facilitate that. And I know that Los Promotores has actually gotten on the internet and helped several people with making their appointments. That's not enough. You're absolutely right. It's not enough. My Turn, that platform is supposed to be in English and Spanish, and it is supposed to be available in multiple different platforms. But we are hoping, if it's not available by telephone, that we'll be able to involve people to help, for sure, elderly people, people of color, people in the Latin community who don't speak English, to make their appointments with them for them. And so we have that on the agenda. We're trying to look at doing that. It is a big problem, and I appreciate you bringing it up.
Thank you, Dr. Coren.
Thank you so much, Jackie. So I wanted to open it up to county staff. If anyone has any further comments.
Ashley, I would like to just follow up on what Dr. Coren said. MyTurn.com, which is a centralized online appointment system that the state will be rolling out and that we will be piloting next week. We think that system will ultimately be effective, though there certainly will be some bugs in it when it starts. Given that it is not a local system, it's a statewide system and operated by the state, we believe, I don't know if I mentioned this, I was on a couple calls with the state earlier today, and this did come up. One of the areas we think that the promotoras can really assist us is exactly in this area. We think that at the local level, we will continue, and even more so, attempt to educate the public on how to get onto myturn.com. So I just wanted to follow up with Dr. Coren was saying that I think this is an area that you will see more of local people working on this to assist others with this particular database. We do think ultimately this will be something that will be very advantageous for the public, and it will assist us in getting more and more people vaccinated. So I just wanted to make that comment, Ashley. Thank you.
Thank you, Carmel. We are running out of time. We do have to wrap it up. So that sums up today's COVID-19 update. A big thank you to our media partners, our interpreters, and our translators for joining us today. Our next update is scheduled for February 19th. Please continue to follow Mendocino County Public Health on Facebook for all COVID-19 updates.
Ashley, this is Carmel again. My apologies. This has been the whole day. I apologize to everyone on the call that I am interrupting Ashley, and to you, Ashley. But one of the questions that has come up is about the restaurants in Fort Bragg. And so I didn't want to miss the opportunity to just bring this up again. I think there's been a good discussion, and certainly Dr. Coren has given you information on what had occurred, some of the issues. But one of the questions that comes up is which restaurants are those? And my understanding is that those 7 restaurants were posted earlier today on social media. So this is not a secret. We're not hiding which restaurants had some of their staff positive, but I don't think that we said that on this call. And I don't know if this particular group is interested in knowing what 7 restaurants there are. I can tell you that one of the reporters outside of this Zoom today was contacting me for those names. So if there's no issue and we've already posted the names on social media, I don't think there's a problem with listing out which restaurants there are if the people on this call want to know. So I just wanted to bring that up. And if there's any interest in knowing which restaurants, I think, Ashley, you can let them know.
Yes, certainly. I do have the restaurants right here. We have all in Fort Bragg: Denny's, Mayan Fusion, Laurel Deli and Desserts, Silver's at the Wharf, Angelina's Bar and Grill, David's Deli and Restaurant, and Noyo Harbor Inn and Restaurant. And if anyone has anything else to say about that topic, any county staff? Okay, I'm seeing none. Thank you so much for that reminder to Carmel. And again, for consistent COVID-19 updates, please follow Mendocino County Public Health on Facebook, and you can always get more information at mendocinocounty.org. Thank you so much for joining us. Have a great day.